Hi, this is Dr. Tom, cosmetic breast surgeon.
Hi, this is Karina, our wonderful medical assistant and surgical scrub tech. And today we're going to answer the 3 most common questions that we're asked during breast surgical consultations.
Question number 1, Dr. Tom, how do I know if I need implants versus a breast lift?
Great question, Karina. Luckily for most of our patients, a straightforward, simple breast augmentation with a breast implant gives them the desired look that they want. But if you're not quite sure, then what I would just recommend is while you're at home, standing in front of the mirror, maybe in your shower, nice and private, you're going to look at yourself and you're going to look at the breast area, and where the breast sits, there's going to be a crescent fold called the inferior mammary fold. And that's going to be the key in terms of where your nipple areolar complex is, in terms of helping us to decide on whether you need just an implant or a lift. So if your nipple is at the fold, can you point that out for us, Karina? Right in that area there, or above, okay, in that area up above, you don't need a lift, you just need a breast implant. However, if your nipple areolar complex is just below that fold, just in this area here, then you're most likely going to need a lift, and that's something we would determine when we examine you and we make that decision together, understanding what the patient's desires are, right? Now, if your nipples are pointing south, unfortunately, you're then definitely going to need a lift. So that's kind of in general how we help to determine for you whether a breast implant or a breast lift or both are appropriate.
All right, question number 2, how big should I go? What size implant?
Yeah. We get asked that all the time, don't we? Yes, that is the most common question and the one that patients have the hardest time trying to decide.
Yes.
Okay, so we have actually a great way of doing it, and it's an age-old trick that we do to have you do at home, and it's called the rice bag test. And so we ask you to go to the local grocery store, and what do we have them get?
We can get a produce bag.
Okay, so you're gonna go to the veggie department and get and lift a couple of these bags, okay? And then what we're gonna ask you to do is to get a cup and fill it up with rice. Yes, rice, and we're gonna ask you to go ahead, the size that you think you want, and just go ahead and pour it right into there. There you go.
Thank you.
And you can see that you now have an approximate size. And we're gonna have you put it in your bra, walk around, see if you like the size, add a little bit more, take a little bit away, and that's called the rice bag test. Now, of course, they're gonna be asking, well, how much is that in terms of cc's, right? So remember that 1 ounce of rice equals approximately 30 cc's. So that means that 1 cup or 8 ounces, 1 cup or 8 ounces equals 240 cc's, which would be an implant of this size. So there you go. That's 1 cup, okay? Now, if you want to be bigger, and let's say you put in 2 cups, where you can see Karina's pointing that on our little cup measuring, and it would equal 480 cc's, and so you can see it's quite a lot bigger, and try to get that in there, would you please, Karina? Okay, we'll get it in there somehow, but anyways, that's gonna be 480 cc's. So that's how we predetermine the rough size that you may want. You'll then come into our office and you'll meet once again with our wonderful Karina, medical assistant and surgical scrub tech, and she'll go over this, taking these different implants that we have. We have a lot of samples, and having you put it in a tight bra. We'll ask you to bring a tight t-shirt on so you can kind of see your silhouette. Stand in front of our 3-way mirror, and together with Karina, you're gonna see what size fits you the best, what you like. I'll then come in and help you to make the final determination. That's how we decide what size breast implant is best for you.
And question number 3.
Oh, our last one, okay.
Last question. Why should I have this procedure under local anesthesia?
Okay, I wish I could say local anesthesia, like she says. That's perfect. Okay, local anesthesia. Well, I have been performing surgery for up to 40 years now, and I find that local anesthesia is much safer for the patient. That's the most important reason to do it. Number 2, the patients have less post-operative pain, and because of that, number 3, the recovery is quicker. So it's a great way, safe, less pain, shorter recovery for patients. Wonderful way to have cosmetic breast surgery.
Right. Thank you for all your questions. And
Wait, And we
we look forward to seeing you.
we really appreciate that your questions. Please feel free to contact us, and we'll be happy to answer them.
And we look forward to seeing you at one of our 3 offices, Santa Rosa and Napa.
And in Maui.
Let's
Stay young together.
Thank you.
Thank you. Bye-bye.
Okay, we gotta work on the last coordination part. Dr. Tom, question number 1. How do I know if I need a breast implant or a breast lift?
Well, luckily, Karina, most of our female patients, if you were to put 2 cups in right there, it would be the size of 480cc implant, and it's right there. So when you look at the 2 sizes, that's what you use. Okay.
Thank you for all your questions.
We really appreciate them, and we're here to answer them anytime. Just give us a call.
And we look forward to seeing you at all 3 of our offices in Santa Rosa, Napa,
and in Maui.
And
let's stay young together. Thank you. You're supposed to say thank you. Thank you.
Thank you.